In this lecture, we will focus on airway and breathing management, including CPR.
Hello, Namaste. Today we will be discussing airway management. If a patient's breathing is compromised, death can occur in a matter of minutes. It is important for first responders to recognize when to give proper airway support. With that, let's begin our discussion.
Airway management is our first priority in trauma support because patients cannot survive longer than 3 to 5 minutes without oxygen. Here we will review our airway anatomy. Air enters through the nose and through the mouth and travels through the trachea, represented here by the white tube, to enter the lungs. The food and beverages we consume travel through the esophagus, represented here by the green tube, to enter the stomach. Importantly, in an unconscious person, the tongue, represented here in red, has a tendency to relax and fall to the back of the throat, obstructing the larynx and the esophagus. In this case, air is then unable to enter the lungs through the trachea. When assessing for airway, it's important to distinguish between a patient who is not breathing and a patient who is not breathing adequately. The patient who is not breathing will be unconscious. The patient who is not breathing adequately will be unable to communicate effectively, as is the case in someone who is choking, severely injured, or having an allergic reaction, such as to a bee sting. When assessing whether a patient is breathing, you'll want to look for the chest to rise and fall, listen for the sound of air movement, and feel for air movement against the side of your face. Look, listen, and feel. Other signs of breathing difficulties include pursed lips, bluish color around the lips, sitting with their hands on their knees, pale skin, anxiety, and confusion. After we've assessed airway and breathing, continue with the ABCs to include circulation assessment. A patient who has no pulse, who is not breathing, will require CPR. A patient who has a pulse but is not breathing or is not breathing adequately will need rescue breathing and supplemental oxygen. Cardiopulmonary resuscitation, or CPR, is a life-saving technique that is used in patients who are unconscious, not breathing, and do not have a pulse. It is important to mention here that if a first responder or no one else is around to witness an injury or to witness the patient lose consciousness, we should assume that there is an injury to the spine so as to take care that we don't further worsen this injury. When assessing for CPR, we'll first start by checking for responsiveness, an attempt to wake the patient who is unconscious. If we're suspicious of a spinal injury, we want to open the airway using the jaw thrust maneuver. If we're not suspicious of a spine injury, then we'll perform the head tilt chin lift maneuver to open the airway. We will check for breathing and check for pulse, but take no longer than 10 seconds to do so. If there is no pulse or breathing, then we will continue to CPR. Here we show the head tilt chin lift maneuver, where we place our one hand on the top of the forehead and one hand underneath the chin to tilt the head and open the airway. This is the jaw thrust maneuver, where we don't want any tilting or movement of the neck area. We'll put our thumbs on the cheekbones and use our fingers to thrust the jaw forward in the direction of this yellow arrow. Now we will review CPR in the adult and child greater than 1 year of age. You should always have the patient lying on a firm, flat surface so that your chest compressions can be effective. You will perform 30 chest compressions. Place your hands in the middle of the patient's chest as shown in this second picture. The first picture is an incorrect method of how to place the hands on the chest. You want to stand at the patient's side, place your hands in the middle of the patient's chest, interlocking your fingers. Your arms should be stiff and your elbows straight, and each compression should compress at least 5 centimeters deep, allowing the chest to recoil between compressions. Continue at a rate of 100 beats per minute. Then, after the chest compressions, you will perform 2 rescue breaths, ensuring that the chest rises. To do this, you will open the airway using one of the maneuvers we just discussed, pinch the patient's nose and cover their mouth with the oxygen-delivering bag valve mask, as shown here, or you may use your own mouth if it is, for example, a family member or someone you're comfortable doing so with. Give 2 breaths that each last 1 second. If you do not see the chest rise, you may need to reposition the patient, as it is an ineffective breath that is either not going into the mouth or is going into the stomach. As a summary, you'll want 30 chest compressions for every 2 rescue breaths. You will also want to alternate with another first responder if possible, performing 5 cycles or 2 minutes of 30 chest compressions for every 2 rescue breaths. It is good to be able to switch with another first responder, as this can be very tiresome. You will become very fatigued after all of the compressions you have performed. If you're unable to give breaths, or you do not have a bag valve mask and prefer not to put your mouth on the patient, then you may just use chest compressions alone. These are the most important part of CPR. You will continue to provide chest compressions and breaths until an artificial external defibrillator is available for use, or until there are signs of life. In an infant less than 1 year of age, you'll check responsiveness by tapping or rubbing the soles of the feet. Do not shake the baby. If the infant is not breathing, place 2 fingers on the infant's breastbone between the nipples. Give compressions by pushing straight down 4 centimeters, allowing the chest to rise between compressions. You will want to give 2 rescue breaths by covering the infant's nose and mouth with your own mouth and gently blow air to see the chest rise. Allow air to escape between rescue breaths. Again, the ratio of compressions to breaths is 30-2. Continue until you have an AED or until there are signs of life. Now we will move on to the patient who is choking. If the patient is able to make vocal sounds, you'll want to encourage them to cough. Coughing may allow them to open the airway and to remove whatever foreign object is obstructing the airway. If the patient is unconscious or unable to make vocal sounds, this is when you'll want to use the Heimlich maneuver. To perform the standing Heimlich maneuver, you will stand behind the patient and wrap your arms around them. Make a fist with one hand and place the fist thumb side towards the patient's stomach, and make sure that your fist is placed above the patient's navel and below the rib cage. Grab the fist with the other hand and pull into the patient's abdomen slightly upward with a quick thrust. You'll want to repeat these abdominal thrusts as necessary to remove the obstruction. Now we will discuss the case of a drowning patient. If the patient is not breathing, you will want to perform rescue breathing. If the patient vomits, you'll want to roll them on their side to remove the vomit from their mouth. If they remain on their back and vomit, there is a possibility that they will then breathe in the vomit, which can cause lung problems or cause them to choke. If there is no pulse and they are not breathing, then of course we should begin CPR and chest compressions. You'll also want to keep the patient warm and dry. As always, if there is an evidence of spinal injury, then we should immobilize the patient and take care when manipulating the patient, especially the neck region. Finally, transport the patient to a healthcare facility as soon as possible. The King LT Airway is a device used on patients with complicated trauma to the airway as a result of burns, trauma, bleeding, vomiting, or any other inability to visualize the oral pharynx. It is also used on patients with a cervical collar. Here we just demonstrate the use of the King LT. You will insert it around the tongue at the midline until the gastric tube lumen, shown here, is at the teeth or the gum line. The airway should enter the esophagus here to create a nice airway allowing oxygen into the trachea here. Inflate according to King LT size to keep it in position. Here is another view of King LT tube placement. Use your dominant hand to introduce the tip into the mouth laterally. Use your non-dominant hand to open the mouth and apply chin lift. You will advance the tip under the base of the tongue while rotating back to midline so that the blue orientation line faces the patient's chin. Advance the tube until the base of the connector, shown here, is at the teeth or gum line. You will then inflate the cuffs maximally using a syringe filled with air to keep it in place. Then finally attach resuscitator bag to the tube while gently withdrawing the tube slightly until ventilation is easy and there is no resistance. Another method for delivering oxygen is to use a bag valve mask. It is important here to use appropriate hand placement to create a good seal. This way, the oxygen within this bag goes directly into the mouth and trachea and does not escape out the sides. It's not always applicable to use the bag valve mask, such as with the elderly, the obese, or pregnant. And one common side effect is that it has a tendency to inflate the stomach instead of the lungs. For this reason, you must carefully watch for the chest to rise and fall. Important points to communicate include the mechanism of injury, if it was witnessed, the vital signs, ABCs, airway, breathing, circulation, and the events that occurred during transit, such as a progression of injuries or interventions of the first responders, and any outcomes of these interventions. In summary, there are different ways to open the airway depending upon the mechanism of injury. CPR is used on an unconscious patient who does not have a pulse, for example, someone who is drowning. The King LT and the bag valve mask, or BVM, can be used as oxygen sources. First responders can also perform rescue breaths in patients who are not breathing or not breathing adequately, but also have a pulse. The Heimlich maneuver is used on patients who are choking to help expel the foreign object.
I hope you have found this information helpful. Now it is time for you to practice these skills so that you will be better prepared in an emergency situation. Please feel free to ask additional questions. Thank you. Dhanyavad.